Alzheimer's disease is a devastating condition that clogs brain cells with sticky protein clumps. But scientists have made a groundbreaking discovery that could change everything. Recent research reveals that they managed to repair a natural gateway into the brains of mice. This allowed the harmful clumps and tangles characteristic of Alzheimer's to be swept away effectively. After just 3 drug injections, the mice showcased significant improvements. They experienced a nearly 45% reduction in amyloid-beta plaques within hours of treatment. These plaques are a hallmark of Alzheimer's disease. Initially, these mice showed signs of cognitive decline. However, after the 3 doses, they performed just as well as healthy peers in learning and memory tasks. Remarkably, these benefits persisted for at least 6 months. While we cannot guarantee similar results in humans, this research represents a promising new direction in drug development. The researchers believe it heralds a new era in the treatment of Alzheimer's. This study shifts the perception of the blood-brain barrier. Traditionally viewed as an obstacle to overcome, it is now recognized as a gate begging for repairs. The blood-brain barrier protects the brain from toxins while blocking many treatments. Previous attempts to deliver drugs relied on nanoparticles or ultrasound to bypass this barrier. However, these methods merely address access rather than repairing the barrier's underlying dysfunction. The researchers from China and Spain have turned this approach on its head. Their goal is to facilitate the exit of amyloid-beta from the brain rather than forcing drugs in. By using nanoparticles, they actively alter the transport dynamics across the blood-brain barrier. These nanoparticles function as tiny engineers that facilitate the removal of amyloid plaques. They target a specific protein known as endothelial LRP1, crucial for plaque clearance. The long-term benefits may stem from restoring the brain's vascular function. Once the blood vessels operate correctly, they begin to eliminate amyloid-beta and other harmful substances, helping restore balance in the brain. Currently, effective treatments for Alzheimer's are challenging to find. Recent drugs show mixed results, mainly slowing symptoms rather than reversing the disease. Some experts argue the focus has been too narrow, concentrating on clearing plaques inside the brain. Instead, the root causes may lie at the brain's borders. Julia Dudley, an expert in Alzheimer's research, cautions that it is early to determine if this method will work in humans. Mice possess different brain structures, and the current study involved a specific dementia subtype. Nonetheless, Dudley highlights that repairing the blood-brain barrier could open new pathways for Alzheimer's treatment. This research is vital as we strive toward finding a cure. In summary, scientists have unlocked a potential breakthrough in Alzheimer's treatment by targeting the blood-brain barrier. This promising strategy could revolutionize how we approach and eventually treat this tragic disease. Stay tuned for more updates on this groundbreaking research.